Hello, my name is Dr. Olaf Beck and I'm an orthopedic surgeon from Germany and specialized in regenerative joint therapies. Today I want to tell you something about ankle tears and ankle problems. It's very common to get distortions of the ankle after sports activity. In the main cases, there will be no specified therapy necessarily, only a small brace to wear it for 4 or 6 weeks to reduce the sport activity, and after this period everything is fine once again. Then we have problems after 2-3 months. After a period without pain, a new pain starts, and this is mostly located as a medial joint part. What's the reason for this? If we have a normal parallel joint and you get this kind of injury, there will be a compression of the medial part between the tibia and the bone. It's called talus. Now, cartilage like to be compressed, neither the bone like to be compressed, and from this heavy damage there can be created an osteochondrosis, and this means there is a necrosis of the bone and damage of the cartilage surface. In this case, if you get pain after 2-3 months after the injury, you have to pass an MRI, because only the MRI indicates the bone edema of the necrosis and the cartilage defect. The X-ray shows only bone structure and there's a small indication, but to get more information about the current bone and cartilage situation, it's necessary to perform an MRI. So which kind of therapy options do you have then to reduce and to get a better bone situation? You should start with the focused shockwave therapy. The shockwave therapy mobilizes the bone cells and revitalize them. So you have to do, depending to the diameter of the defect, 3 or 4 or 5 times a shockwave therapy between 1 week. So at least 5 weeks you have to do the shockwave therapy. And you have to reduce the weight bearing using a boot, brace boot, to stabilize the joint and to reduce the weight bearing. After this, 3 months later, once again, you have to repeat the MRI examination to check out the bone rehabilitation which you got after the shockwave therapy. If there is a cartilage defect as well, it can be treated via stem cells, or if the defect is too huge and there are free bodies into the joint, it will be possible to repair this with a collagen via an arthroscopic therapy. When you use a special camera which can be banded so you can reach the top of the talus, an arthrotomy, which means an opening of the joint, is not necessarily. So we use this kind of technique to avoid secondary problems after an arthrotomy, and we use this nanoscope which can be banded so you get an overview of the defect and so you can treat it in our consultation here in Germany. So if you want to get more information, check out our homepage and use our contact form to stay in contact with us. Meanwhile, 48 hours we will respond to your questions. So all the best for you and your joints. From Germany, Dr. Beck.